Good morning, everyone. It's good to see you again. I wanted to talk about a day that was memorable for many of us, and that was last June when we had the opportunity to participate in a World Elder Abuse Awareness Day at the White House. It was a fabulous day both because of the content, but also because so many people participated, including the White House. This was the first time the White House had ever hosted an event talking about elder abuse. At the end of the day, the thing that impressed me the most was this overwhelming sense that every single person we reached out to put together the day said yes. That as we continue to work on this topic of preventing and addressing elder abuse, everyone I've ever talked to about this says yes. What can I do? How can I help? So I want to thank you for saying yes, for being willing to have this forum. And I'm also very pleased to continue to work in an administration that says yes. From working with Secretary Sebelius, who is someone I've worked with for a long time, who's willing to help, to the White House. I am pleased this morning to be able to share the podium as we kick things off with Carol Johnson, who's one of those people. Carol is with the Domestic Policy Council at the White House. Carol is someone I've worked with on many different issues impacting older people, and is one of the people that helped us put together the day last June. And a few weeks ago, I called Carol and had a conversation and said, what else can we do? How else can we say yes? And I think what we both know is that often in this work, being present and showing up is very, very important. It's a way to move forward. It's a way to engage in dialogue together. So I'm very pleased to introduce this morning to you Carol Johnson, our colleague and our very good friend at the White House. Carol, thanks for being here.
Good morning, everyone. Thank you for the opportunity to be here. I am one of among many people in the administration who is grateful for the fact that Kathy Greenlee is leading these efforts. She has been a tremendous partner and just a great leader, and we're very excited about this effort and her work at the Administration on Community Living. She's really bringing together a broad swath of communities to tackle some very challenging issues. I join with all of you in really saying how excited we are about this day and what you all hope to accomplish today. We're here because we really believe that people deserve in their later years of life to live safely and with financial security. And unfortunately, we know that for far too many individuals, they are denied that opportunity because of abuse, neglect, or exploitation. And these are our parents and our neighbors and our friends in our community. And they've already contributed so much to our societies and continue to contribute, and they deserve security and protection. So, we know that seniors are concerned about pointing out abuse and neglect. They're concerned what it means for their independence. They're concerned what it means for shame and embarrassment. And so we really need to create the tools and mechanisms that give them the safe place so that they can come forward and we can reach out. And we've tried over the years, those of you in this room know there have been efforts over the years to try to lift up these issues and find ways to better coordinate. And they've been challenging. And that's why we're so happy as the Obama administration to really lean forward into this issue, to really take steps through the Department of Justice to really focus on targeting those who exploit seniors through healthcare fraud or consumer scams or other schemes, to really focus at the Consumer Financial Protection Bureau on financial issues for older Americans. And perhaps I'll say maybe most importantly, but maybe that's because it's closest to my heart, really the historic passage of the Elder Justice Act as part of the Affordable Care Act. We thank those of you in this room who were instrumental in making that happen, and we're very excited about the framework that creates for guiding policy development going forward in tackling this issue. We were so happy, as Kathy pointed out, on World Elder Abuse Day last year that we were able to not only did the Affordable Care Act facilitate the passage of the Elder Justice Act, but we're also able to find Affordable Care Act funding through the Prevention Fund to be able to stand up the first elder abuse prevention grants last year. That $5.5 million is at work in communities across the country. I'm guessing that some of you in this room are those grantees. We've heard some preliminary reports about the results from those efforts, and we're very excited about what we can learn and how that work can inform our policy development going forward. Part of that effort was also to stand up the Elder Justice Coordinating Committee, which is really a terrific way, outlined in the Affordable Care Act, a terrific way for the federal government experts to better get together and coordinate efforts and to leverage our resources to extend the efforts of elder abuse prevention across the federal government. So we're excited about that effort as well. But all of this is really the beginning, and we are very excited about these steps, and we look forward to working with you both on what the outcomes of today is, what the outcomes of the initial grants are, to inform the research base, to inform the evidence base, to help us guide policy development going forward. So thank you so much for the chance to be here, and I'm just very excited about what we had the opportunity to learn today.
I think we all have one of these lists. Good friends to have. And so, Carol, you're on my list of good friends to have. Thank you for coming. Yeah, thank you. It's very good to be here. I want to thank you all for your diligence, your patience in listening to me as I keep talking about this particular topic, and your willingness to have this 2 days focused specifically on elder abuse prevention and elder abuse. I think it's been 1.5 years ago since I came to the forum meeting and started talking about my passion and commitment for this issue. It continues to astonish me that it's been almost 4 years now that I've had the honor of serving as the Assistant Secretary for Aging. It's a very humbling opportunity to serve in this type of a leadership position, not only because of the opportunities to do this work domestically, but because of the opportunities to do this work globally. And unfortunately, I get invited to do more global work than I can afford to do at this point. I would very much like to have a budget that allowed me to travel more and participate more on an international stage. So I have to be selective, but it's very, very important that the United States participate and lead globally. For me, I have a very strong sense of urgency in tackling this issue. And the urgency comes from the fact that I have a job that's time limited. None of us who serve in this position as Assistant Secretary gets to stay. That's the downside of having a job you really like. That's a politically appointed position, is you don't get to stay. So I think that the best way that I can be responsible to myself, honestly, is to pay attention to what's most important, not just to the nation, but to me. What do I want to get done? What can I help with while I'm here? And elder abuse for me is that issue. There is so much that's needed in this field, and so many people who are willing to help, that it's imperative that we take the time to stop and focus on it. So I want to go back and actually talk about what I first talked about. I brought my speech from when I spoke 1.5 years ago, because I actually am not overwhelmed by it. I'm so absolutely optimistic that we can make a difference and that what we're doing here today makes a difference. And when I approached the IOM and started talking to you all, I talked about the fact that in many respects, the very fundamentals that we need to tackle this issue are things that we've been working on for a very long time. That elder abuse in many respects is a subset of the other issues that we're working on, and that we have to make sure that those other issues also address elder abuse. And I have some specifics. When we talk about mental health, we have to make sure that we use the assets in this country that are talking about mental health to identify the seniors who inflict violence upon themselves by committing suicide, the problems that we have with cognitive impairment, the problems that we have with depression. That the mental health field in this country is a huge field, and in this field we must talk about the abuse of older people in this country. Carol mentioned the Department of Justice, which is one of our greatest assets at the federal level. We have an entire endeavor looking at law enforcement in this country, and we must work with law enforcement to talk about this, because elder abuse is a crime, and we need to make sure we work with prosecutors and judges at the federal and state levels to talk about elder abuse. I keep talking to people. I have a lot of meetings in my office about this topic. I met with the association that represents state courts recently, where they have put together materials and guidelines for prosecutors and for judges on how to identify elder abuse. You know, every probate judge in the country deals with elder abuse, whether they realize it or not. Here's my friends from the state courts who they recognize or not. Every probate judge in this country deals with elder abuse. I have a background in working in a domestic violence shelter and domestic violence. Jackie, do you do this too? I think you've worked in the domestic violence field. You know, the domestic violence field, for those of us who come from this field, is decades ahead of elder abuse. And yet there is late life domestic violence. Late life domestic violence is a little bit different because there are people who need services who are abused. So how do you do care planning for them or safety planning for them? How do you continue to support someone who's a victim of domestic violence who's 75 or 85? It's a different kind of domestic violence, but it's still power and control, but it happens later in life. So domestic violence has to be a part of the solution. And in a broader context, there are people who also work, of course, on child abuse, kind of the bigger family violence context. Child abuse led the way. Child abuse was ahead of sexual assault, domestic violence, and elder abuse. And if we look in the context of the family, it's stunning to realize that in many conversations when we talk about family, we actually are not talking about the older people in those families. That in this country, by and large, when we frame family issues, it's about adults and children as the family. The nuclear family really does include those 4 or 5 people who get in a minivan. That's what we think of as a family, instead of the elders in their lives and the larger family. And from the field of family violence, we also need to talk about elder abuse. We have to do it. Elder abuse, because we're going to talk today about the global, today and tomorrow, about this being a global problem. The World Health Organization has declared that elder abuse is a violation of an older adult's fundamental rights to be safe and free from violence. Recent estimates suggest that 1 in 10 older adults experience physical, psychological, and sexual abuse, neglect, and financial exploitation. This isn't all about financial exploitation. We talk about that a lot, but it's not. Only a small fraction of this abuse is reported. Predictions indicate that by 2025, which is getting closer, the global population of those 60 plus will double to 1.2 billion. And within the next 2 decades, the number of older adults will exceed the number of children for the first time in history. And those of us in the field of aging know this. Whether you're providing aging programs, you're doing aging demographics, I always say it looks like this. We're getting a lot more people around the world who are older. And the sad reality is that those of us who do this planning must also recognize that means we have more people who will be abused. And we do planning right now. And these are national conversations. These are national conversations in every nation. How will we afford the care for this many older people? How will we be able to take care of them? How will we afford it? Where will we deliver care? How can we provide care in the community? There are many countries talking about their aging populations. And what we need to make sure that we talk about when we talk about these aging populations is the fact that not all of these individuals will be safely aging or safely living in the community, that we must talk about it. So while we have wonderful building blocks, because we have the components of these social movements that's been working on violence and abuse, we also, because this is elder abuse, need to talk specifically about elder abuse. If we only attach it or attack it from these collateral opportunities, we actually won't get at the heart. That elder abuse is its own field that also must be addressed. And since the 1.5 years that I came here, I've done a lot more work, and I'm learning, like we all should be, like we hopefully will be in these 2 days. And I'm learning more and more about what tackling elder abuse head-on will mean for us. And at the core of all of this work, there's a very fundamental problem that sets elder abuse apart from any of these other fields, which is why it has to be its own unique endeavor. And that's the problem at base of cognitive impairment. That the diminished capacity and the diminishing capacity of people as they age is their largest risk factor and is the hardest thing for us to address, Prosecutors will try to tell you that it's impossible to prosecute because they've got a person on the witness stand who has dementia. Unless you talk to the prosecutors who say that's their favorite witness, because it shows how vulnerable this individual is. Cognitive impairment will be the challenge that we need to address in terms of intervention and screening, talking to families, talking to prosecutors, talking to researchers. How do we identify and deal with cognitive impairment and do so in such a way that supports the individual? Because the role and the goal is not to take over someone's lives, but as they age, to provide them additional support. And as someone begins to struggle with their own ability to make decisions, those decisions and those capacities that make them vulnerable, how do we best support them and support their autonomy and their direction in their own life? I have, like I said, been doing more thinking, and I'm not overwhelmed. I'm afraid you will be, I have to tell you the truth. I'm afraid everybody that I talk to about this will be overwhelmed because you all think your plate's full. That this is also one of the biggest impediments to all of us who talk about this field. It's like, yeah, this is really important and we've really tackled a lot. This is hard. I mean, this is sort of one more item on an already full agenda and an already full budget. I actually see that differently now. That every single person who works with seniors right now has to work on this issue, not as something additional to what you're already doing, but as a part of the competency of what you're already doing. Because if we don't address elder abuse, the violence against older people, it will undo every other support we put in place for older people. So we have invested at the Administration on Aging a lot into evidence-based programs. What can we do to help older people stay healthy and stay in their homes? If we're going to help someone manage their diabetes so that they can remain independent, I mean, the whole sort of medical interventions. How do we help people be healthy? That whole work, all of it, is undone or undermined if someone beats that person up. I mean, this is actually not healthy to be beaten up. And so if we're working on the health and longevity of seniors, and we don't talk about the fact that violence against them will undermine and undo this, we actually will never be successful in talking about senior health. It has to be seen as part of the work. There are a lot of people in the universe talking about financial planning or thinking maybe we should be doing more for financial planning. But many partners, from financial services to AARP works on this, many people in the field of aging, what can we do to make sure that seniors have the assets that they need? Please, won't you save more for retirement? This whole conversation, if we're successful, is thwarted if someone steals those resources. And so we can't just pretend that if we do this nice work to help people be autonomous, that it'll be the end of the story. That we actually have to protect against the very thing that will pull it backwards. And so I hope you all will think, and as we spend these 2 days together, not of elder abuse as something else, even though it needs its own study, but the fact if we don't do it, everything else we're doing will be ineffective. And I think this is so broad in my thinking, it keeps growing, that even as we talk about public health and we look globally at public health systems, if we need to work internationally on clean water and vaccinations and how we help people just be healthy, if they're parked in the back room by a caregiver who never feeds them or neglects them, the fact that they have clean drinking water and a safe place to live in is undone. That it has to be considered a part also of a public health response, that this be completely embedded in all of the work that we do. I think we have, in looking at the agenda for this week, many wonderful, it's not going to be a week. It feels like I'm going to keep you here all month. I wish. I really do wish. That would be great. But I think we have to think about this as we look at the topics in the workshops for this week, that this really is an international issue, that global violence is a problem. Global violence against older people also reflects cultural differences, so we must talk about how we can approach this topic in a culturally competent and understanding way. We do that work at the Administration on Aging most directly, I think, when we talk about the support we have for programs that support Native American elders and how can we deliver those programs in a way that are culturally competent. This also then needs to be reflected internationally. How do all of our programs internationally respect cultural differences, but also get at the fact that, that violence is a problem, that violence is a crime, and that violence is not healthy, and that we have to address it. We will be talking about research and practice. Research is challenging. There are questions I ask people, and I think this is a good time to talk about it when we talk about research. I came up with these questions a year ago when I was talking to a big conference on aging. And they're relatively easy questions that are impossible to answer. What I would ask everyone who deals with older people is, are any of the people that you serve or work with abused? And this is the only question in these three that's easy. Are any of the people that you work with or serve abused? And the answer is yes, because 1 in 10 older people is abused. So someone that you work with, if you see any older people, I don't care what I don't care what you're selling stuff at the drugstore, 1 in 10 people who are older will be abused. The second question is, do you know who they are? And this is very difficult. How do we identify and screen and figure out who the older people are that are abused? This is where research is needed so that we can do identification and screening to even find out who the people are in our world, quite literally, that are abused. So the second question is, who? They're out there. Who? How do I find them? And the third question is, do I know what they need from me? And that's different than what we can do for them. Because it's really, I love working with older people because of their fierce independence. They can be cranky, they can be difficult, they can be wonderful, but they are all independent. So what do they need from us? And if each of us, as researchers or people working in the legal system, whether we're a prosecutor, whether it's Carol, whether it's me, if we know what older people need from us, then that's what we should deliver. And that's our work to do. And it will take all of us kind of individually to figure out where this intersects with our work and what do they need from us. You will hear from some of my favorite people in this space in the next 2 days. You all are here. Hi, Larry and Dan. What do they need from you? Services. That's what you're delivering. So everyone has to figure out what people need from them. And if we all did that, we would actually have the response that we need. So I'm going to go back to where I started. Everything we need is in front of us. We need to assemble it. We will sometimes need to pay for more things than we're paying for now. We need to invest in research, but we actually know a tremendous amount. My goal, other than keeping you here all month, is to really do this in such a way that we keep asking people to help. And everyone I've ever asked about this has said yes. And if we ask enough people to help, I'm not Pollyanna, but I do believe that we are at a tipping point at the social movement that we need to really move forward to tackle this problem. And that this is the best thing that we can do. And that the IOM has a critical role in this. And that's where I came, Patrick, when we first talked, when you came over to my office. It's like, you can help us move it. And if you can help move it, that's the most that anyone in this space could ever ask. So I applaud you for your attention. You will help us move it. And I look forward to the next 2 days. I'm going to be here the whole 2 days. So thank you all very much.